Imagine a scenario playing out. Could be in barns, pastures, maybe even out in the wild somewhere. A large pregnant animal, right on the edge of bringing new life into the world, suddenly finds herself in, well, unimaginable distress. The very organ that's designed to nurture that life is twisting against itself, kinking up, cutting off vital supplies. It's this silent, internal race against time, and it's a huge challenge, even for the most skilled veterinarians. Today, you and I are taking a deep dive into this fascinating and, frankly, critical condition known as uterine torsion. We're going to really zero in on how it affects two quite distinct animal families. Camelidae, so that's your camels, llamas, and alpacas, and cervidae, which covers all the deer species.
Yeah, and our sources, a couple of really detailed veterinary texts, have given us a pretty crucial window into this obstetric emergency. Our mission really is to pull out the most important bits, helping you understand the what, the why, and the how of this condition. From those signs that can be quite subtle, right through to the life-saving treatments that can hopefully turn things around. It's a compelling look, really, at a specific and often life-threatening challenge in animal reproduction.
Okay, so let's unpack this then. What exactly is uterine torsion, and why is it such an immediate, urgent concern?
Okay, so at its core, uterine torsion is basically a mechanical problem. The uterus twists along its length, its longitudinal axis. You can sort of picture it like a garden hose getting kinked, right? But this hose pipe is carrying life.
Right.
And that's not just uncomfortable, it's a major obstetric emergency. Because that twisting, it very quickly compromises the blood flow, both to the uterus itself and, really crucially, to the fetus inside. This often leads straight to difficult births, what vets call dystocia, severe fetal distress, and really serious complications for the mother, too.
That's a pretty terrifying image, the kinking hose.
Yeah.
So what actually triggers something like this? Is it just, bad luck? Or are there specific conditions that make it more likely for these animals?
Well, it's rarely just random bad luck. There are definitely several factors that contribute. Most commonly, we see it crop up in the last trimester of pregnancy. That's when the uterus is obviously at its heaviest, it's more mobile, and that just makes it more prone to getting displaced. Anatomically speaking, animals with a uterus that's relatively long and mobile are, well, more predisposed. Then you have contributing factors like maybe excessive fetal movement or a sudden shift in the fetus's position inside. We also think physical trauma or even just really vigorous activity might sometimes initiate a torsion. And yeah, generally larger breeds and what we call multiparous animals, so females who've given birth multiple times, they tend to be a bit more prone to it.
Right, that paints a clear picture of the setup, the risk factors.
hmm
But here's where it gets really interesting and also quite alarming. The why behind the immediate danger. Why is that twist so instantly problematic, beyond just blocking the birth canal?
Okay, this is the critical cascade, the sequence that makes it so dangerous. The twist first acts like a dam. It traps blood inside the uterus because the venous return, the blood flowing out, gets obstructed. This leads really rapidly to congestion and edema that's fluid buildup, making the uterus swell up. But even worse, it then acts like a shut-off valve. It cuts off the fresh, oxygen-rich arterial blood flow to the uterus and, critically, to the fetus. It's this rapid oxygen deprivation that can be fatal, sometimes in just a matter of hours.
Hours, wow.
Yeah. And the severity really depends on the degree of twist. It can range from maybe a partial, like 90 to 180-degree rotation, all the way up to a complete 360-degree twist, or sometimes even more. The longer it's twisted, the worse the outlook.
Okay, with that foundational understanding, let's zoom in on our first specific group, the Camelidae. This family, camels, llamas, alpacas, they actually have some really surprising distinctions when it comes to this condition.
Absolutely. The prevalence, how common it is, differs quite significantly, and this is a really key point. So in dromedary camels, uterine torsion is definitely a significant cause of dystocia, difficult births. One major study found it accounted for about 23.4% of them. However, the striking difference here is that it's actually considered infrequent compared to how often it happens in South American camelids.
Infrequent in dromedary, yes.
Right. But then you look at llamas and alpacas, and uterine torsion is much more common. In fact, it's the #1 cause of dystocia that needs surgery. It accounts for nearly 60% of those surgical cases. That's just an astonishingly high number.
Wow, nearly 60% in llamas and alpacas. That's a huge figure, especially compared to their dromedary cousins. Is there like a general consensus in the veterinary world about why? Is it specific anatomy or behavior that makes such a dramatic difference?
Yeah, it's actually quite well understood now, and it really does boil down to some unique anatomical things and also some behavioral factors. One of the most significant anatomical points in camelids is that Almost all pregnancies, like 98%, occur in the left uterine horn.
Left horn? I've heard.
Exactly. And because of this, the pregnant or gravid uterus tends to twist over the non-pregnant empty horn. This specific setup has a direct consequence on the direction of the twist. The vast majority of these torsions in camelids are clockwise, so turning to the right if you're looking from behind the animal.
Clockwise, right.
Yep. And beyond just anatomy, behavior is thought to play a part too. Particularly the way camelids, especially if they're moved to a new place, tend to roll quite vigorously on the ground. And these torsions, they typically happen near the end of pregnancy or during the first stage of labor, which is exactly when the uterus is sort of at its most unstable and under the most pressure.
So if you're an owner, or maybe a vet out on a farm call, seeing these may be subtle signs. What are the first clues someone might pick up on before it becomes a full-blown crisis? Is it easy to mistake it for something else early on?
That really is the challenge, isn't it? Because those early signs can be quite subtle. They can easily look like general discomfort or maybe mild colic. You might just see some abdominal pain, restlessness, maybe they go off their food, their breathing rate might increase. The animal might just seem a bit off, or maybe mildly depressed. It's like trying to solve a puzzle when time is really ticking and your patient can't tell you what's wrong.
Right, like guesswork, almost.
A bit, yeah. Then, as it progresses, you'd start to see more obvious signs of dystocia, like failure to progress in labor, or maybe an abnormal presentation of the fetus if you can examine them. A vaginal exam at that stage might reveal a telltale twist or a sort of taut band inside the birth canal. In really severe cases, the animal might start showing signs of shock or systemic compromise. And yeah, specific camelid behaviors like that persistent rolling, kicking at their belly, maybe vocalizing a lot, those are all big red flags for significant distress.
And misdiagnosis.
Oh, yeah, definitely. In the early stages, it could easily be mistaken for general colic or maybe indigestion. That's why a really thorough veterinary exam is crucial if those sorts of symptoms stick around.
Okay, so once you suspect it might be torsion, how do you actually confirm it and figure out the whole picture, to decide what to do next? It really sounds like time is absolutely critical.
Time is everything. Diagnosis mainly relies on the physical exam, particularly rectal and vaginal examination. Think of it like this. If the twist happens after the cervix, so it affects the birth canal itself, we call that a post-cervical torsion. A vet can often feel those characteristic spiral folds with the vaginal exam, and the direction of those folds helps tell you which way it's twisted.
Okay.
But if the twist is before the cervix, sort of deeper inside the abdomen, that's a pre-cervical torsion, then rectal palpation becomes the key diagnostic tool. The vet can feel these taut, displaced, broad ligaments stretched across the uterus. It gives them a tactile clue.
Where they can feel the tension.
Exactly. We also use ultrasound, which is really helpful. It lets us check if the fetus is still viable, check its position, and visually confirm the torsion itself. It gives a clearer picture. Sometimes, careful palpation of the abdomen from the outside can also give clues about the direction and degree of the twist. And of course, the clinical history, observing those signs of discomfort, dystocia, lack of labor progress, that's always a vital piece of the puzzle. I should probably mention, though, while rectal palpation is generally pretty feasible in llamas and alpacas, it can be really difficult in those big dromedary camels just because of their size.
Right. Makes sense. This sounds like a true emergency demanding immediate action. So what are the treatment options, and do they differ much between, say, a llama and a dromedary, considering that size difference you just mentioned?
Immediate intervention is absolutely paramount. Manual correction, trying to untwist it without surgery, is often successful, especially in llamas and alpacas. One common technique is called rolling the dam. Basically, the animal is placed lying on its side in lateral recumbency and then carefully rolled in the direction opposite to the torsion. While that's happening, an assistant usually applies pressure to try and stabilize the fetus and uterus. Sometimes this involves using what's called the plank in the flank method.
Plank in the flank.
Yeah, it's where a smooth board is pressed against the animal's flank, the side of the abdomen, to help keep the uterus in place while the animal is rolled. It helps leverage the roll effectively. Manual repositioning through the birth canal is also tried if the twist seems accessible that way.
Okay, but what if that doesn't work?
Right. If manual correction fails, or if it's a complete 360 twist, or if there are clear signs the fetus or mother are compromised, or maybe if the cervix just isn't opening up, then surgery, a cesarean section, is needed. And actually, C-section is often the go-to treatment for dromedary camels anyway, precisely because their size and, frankly, their potential resistance can make that rolling technique really difficult, sometimes even dangerous for everyone involved.
Safer to go straight to surgery then?
Often, yes. During the surgery, the surgeon can untwist the uterus once the abdomen is open and then deliver the fetus, either vaginally as possible after untwisting, or usually through an incision in the uterus itself, which is called a hysterotomy. And naturally, supportive care is vital. Things like IV fluids, anti-inflammatory meds, antibiotics are given as needed to manage shock, pain, or any secondary infections.
Okay, now let's switch gears quite dramatically over to Cervidae, our deer species. The story here sounds quite different and maybe even more challenging because of the nature of these animals, especially if they're wild.
You're absolutely right. It's a stark contrast. Information about uterine torsion in deer is, well, it's extremely limited. Most of what we know is kind of extrapolated from other ruminants, or it comes from very rare case reports, both in farm deer and occasionally in wild ones. It's considered a genuinely rare event in deer, very unlike the situation in llamas and alpacas.
So, much rarer. But the causes, are they similar?
The general suspected causes are pretty similar, yes. Late pregnancy, an elongated and mobile uterus, maybe sudden movements, fighting between deer, or trauma. Environmental factors could also play a role, things like poor footing, slippery ground, or maybe being confined in small areas where they might panic or move awkwardly. While it is rare, it has been noted as a potential cause of dystocia in farmed red deer. And there are documented isolated cases, like one in a sambar deer where the torsion was actually linked to a neoplasm, basically, a tumor or abnormal growth. And another case was documented in a free-living roe deer. One major concern specific to deer is that the circulatory disturbance from the torsion can really weaken the uterine and vaginal walls, potentially leading to rupture, which is almost always catastrophic.
Okay, so it's rare, and in wild deer, they're obviously not presenting themselves for a vet check. This raises a big question. How on earth would you even diagnose this in a deer? Especially a wild one versus, say, one on a deer farm.
That really is the crux of the challenge. For a wild deer, a definitive diagnosis of uterine torsion would almost certainly be a postmortem finding. You'd find it after the animal has died, usually following an unresolved dystocia. There's just no practical way to intervene or diagnose beforehand.
Right, it's found after the fact.
Exactly. Now, in farmed or captive deer, where you have more opportunity for observation and potentially intervention, the condition would likely present as a failure to progress during labor, similar to other species. In that setting, a physical examination, maybe palpation per rectum or a vaginal exam, possibly combined with ultrasound, would be the tools used to try and detect the torsion and check on the fetus. But the practicalities are very different from dealing with a llama or alpaca. Deer temperament and just accessing them safely often requires chemical immobilization or very specialized handling facilities. It's a significant hurdle for diagnostics.
And the treatment, then? Given how rare it is, and the animal's nature you mentioned, the reproductive tract might be more delicate.
Yeah.
Does that change the approach compared to a camelid?
It absolutely does. That's a critical point. Because of the generally more fragile nature of a deer's reproductive tract, any prolonged or forcible manual manipulation, like trying to roll them or manually reposition the uterus, is considered really risky.
Too much risk of causing more damage.
Precisely. There's a higher risk of causing further tearing or even rupture. So therefore, if uterine torsion was diagnosed, especially in a farmed or captive deer where intervention is even feasible, a cesarean section would almost certainly be the recommended course. It would probably be viewed as an early treatment option, maybe even the primary one, rather than a last resort like it might sometimes be after trying manual methods in other species, simply because manual correction carries too much risk for such a delicate patient.
So C-section is the safer bet.
Generally, yes. And just like with the camelids, supportive care afterwards, fluids, antibiotics, anti-inflammatory drugs would be essential for recovery.
It really underscores how vigilance is just key across the board, doesn't it? So pulling back from the specific species for a moment, what does this all mean for preventing this condition, if possible? And what's the general outlook once it's diagnosed in any animal?
Well, for prevention, the principles are largely universal, really, applying to both camelids and cervids where applicable. It mostly boils down to minimizing those known risk factors. So trying to avoid excessive handling or really stressful activities, especially late in gestation. Regular monitoring is also paramount, just keeping a close eye on pregnant females, particularly in that last trimester, looking for any early signs of distress or discomfort. And finally, good general management practices ensuring proper nutrition, appropriate exercise to maintain overall health. These can also help minimize those excessive fetal movements that might sometimes contribute to a torsion developing.
Makes sense. And the prognosis?
The prognosis. Well, it's generally good if the condition is diagnosed early and managed promptly. Early intervention really does dramatically increase the chances of a positive outcome for both the mother and her offspring. However, and this is the crucial part, any significant delay in treatment can lead to severe complications. We're talking about things like fetal death, uterine rupture, or peritonitis, which is a really serious infection of the abdominal lining. Any of those drastically worsen the prognosis, and unfortunately, they can ultimately be fatal for the mother. It truly is a race against that internal clock.
It's really humbling to realize just how much hangs on spotting it early, isn't it? The difference between, well, life and death. So we've taken quite a deep dive today into uterine torsion, looking at its causes, the symptoms, the treatments, across both camelids and cervids. From that surprisingly high prevalence you mentioned in llamas and alpacas, often driven by those unique left horn pregnancies and the typical clockwise twists, right through to the much rarer and incredibly challenging cases we see in deer. It's clear this condition demands real vigilance and swift veterinary action.
Yeah, and what's really striking, I think, is how specific things like anatomical predispositions, certain behavioral traits, even the animal's environment, can so clearly dictate how often this happens and how it needs to be managed across different species. It really encourages us, I think, to consider that intricate balance between biology and environment and overall animal health. And of course, the importance of veterinary understanding being tailored specifically to each species. So maybe the next time you see a pregnant animal, perhaps at a zoo, on a farm, or even if you just glimpse a deer in the wild, you might find yourself wondering about the unseen complexities of their journey towards motherhood and just how much can potentially go wrong, but also, thankfully, how much can go right, especially in those really crucial moments.
Thank you for joining us on this deep dive.